Hi, this is Mitch Mitchell of TT Mitchell Consulting Incorporated. Today I've got my healthcare hat on, and I want to talk about the three healthcare items that are the most costly. You know, you've been hearing a lot about the Affordable Care Act, and, one side says, well, this is going to raise healthcare costs, and the other side says, well, no, this is going to help keep rates down and whatever. And let me tell you something. None of that stuff is all that important. And I know you're probably going to want to argue about it, but the truth of the matter is I'm in the industry and I am a healthcare finance consultant. And there's three other things that are really driving most of the healthcare costs up rather than the Affordable Care Act. Trust me, insurance companies do not drive healthcare costs up as high as any of the three things I'm going to mention. So the first one I'm going to talk about are prescriptions. Prescriptions drugs are costly. And drugs in themselves are just pretty costly. Now, we're not talking about aspirin and Tylenol and whatever, but, we're talking about some of these other drugs and things that are very costly. Not the stuff that you can get over the counter and probably not even the stuff that you can get at your local pharmacy. But, there's things in the hospital that you use, things that will bring down your blood pressure, things that will thin your blood, things that will actually help keep you alive, such as chemotherapy. Things that you need, such as contrast material that you have to put in the body so you can do x-rays and MRIs and all stuff. All this stuff is extremely costly. A cancer treatment, you've all heard about chemotherapy and whatever. Some of those concoctions can be $15,000 to $20,000 a pop. And you know what? Nobody is paying that. Either you're going to be on self-pay, which basically means you're getting it for free, so to speak, or not self-pay, my God, Medicaid, I meant. You're getting it for free. If you're self-paid, you're just not getting it at all. Or your insurance company is only going to pay a portion of that. So hospitals take a big bath on a lot of these pharmaceutical types of things. And all the other stuff that they have to keep. Sometimes you don't use all that much of it. Sometimes you use a whole bunch of it. But pharmaceuticals themselves cost a lot. Now, I don't probably need to tell you this if you have any kind of prescriptions whatsoever. If you're over 40, you're probably on something. And you know that without insurance, that stuff can be costly. I'm diabetic and, I work for myself. And if I didn't buy my insulin where I buy it, it would be about $500 a month for insulin. Don't want to pay $500 a month for insulin. So there you go. Pharmaceuticals, we all know that. The second thing that is really expensive and drives up costs are hospital supplies. It's amazing how expensive this stuff is. Now, think about pacemakers. Let's just go at pacemakers, for example. Years ago, an expensive pacemaker came in at around $20,000. Nowadays, an expensive pacemaker can be anywhere from $45,000 to $50,000. That's just a real expensive one. There's a big range of pacemakers, and each one, they step up and they do different types of things. And, pacemakers are important. You want to keep the heart going. But the price of these things is just out of this world. And let's talk about something simple. Screws. Basically, for the most part, a lot of these screws are just the same kind of screws that you could go to a Home Depot and buy for like $1.50 or whatever. They look the exact same, but because now they're going to use it to basically screw bones together, to try to tighten things, you could get charged as much as $5,000 for a screw. I'm kidding you not. It looks just like another kind of screw. Now, someone will tell you, well, we had to make it out of titanium and we have to do all this testing and standards to make sure it's a screw. $5,000. And it's not just screws. It's all kinds of things. There are things that they will say, well, by using this, it'll cut down the time that someone has an operation from 3 or 4 hours to a half hour, or we won't have to be as invasive. But all these things are disposable, and some of these things start at $10,000. So you go in for a 30-minute procedure, it's $10,000 off the top. And that's not including room charges later on or anything else. These things are steep. Now, am I going to say that they're all junk? No, I'm not going to say that, but come on. They're really expensive. And, the hospital has to do their little bit of markup on the back end, just like any other business would do for items that they're buying that they're going to use. So, don't blame the hospital for this. This stuff is expensive coming from all these vendors. The final thing is a little different from the other two, and it's basically regulation. Regulations are what basically chokes hospitals into what they can or can't do. Everything is regulated. to cleaning rooms, to vacuuming the rug outside is regulated. For registration is regulated because of privacy laws. Medical records have to be so detailed, otherwise the insurance company does not have to pay. And they also have to be regulated because you got Medicare who comes in, you have Medicaid who comes. You have every state has these people who come in and they look at all this documentation. You have organizations like JCO, the Joint Commission of Hospital Accreditation. Basically, they come in and they go through an entire hospital. They look at everything. And you know what? You have to pay them to come in and give you accreditation. Electronic medical records, that's kind of costly. You have to pay every year or, every so many years to keep your basic hospital structure, your computer structures up to date. And all this stuff has to be regulated. The government, first you have state government, you have federal government. You have all kinds of regulations. You have regulations for all those people who go to the emergency room. All that stuff is regulated, and fines are steep. You have regulations for billing things. All you need is some auditor that the federal government hires to come in and look at something and determine on their own that, yes, you've been making a mistake, but we're going to call it fraudulent and hit you with a fine of $2 to $5 million. Some hospitals have had to pay upwards of $60 million for something that it was just a mistake. Now, should they be watching out for those kind of things? Yes. Were they billing people for those kind of things? Yes. Were they getting paid for all that stuff? There's an interesting thing. No. They weren't always getting paid for that stuff, but that doesn't really matter. What matters is that it was on a bill, they were auditing it, and even though it wasn't paid, they consider that fraudulent. And so you get hit with all these fines. Regulations are a big killer. Now, there's a couple other things I could have gone into, brought up as well, but no, those three really are the things that drive healthcare costs. It's not the Affordable Care Plan, it's not Medicaid, it's not Medicare, it's that other stuff. And who hasn't been a patient who's had to deal with some of this stuff? I'm just putting it out there. So, if you have any questions about that, or you want to comment on it, fine and dandy. But, you really need to know these types of things because, I go around all these different places and people want to say, well, just hospitals are doing this and that, whatever. Most hospitals are basically on a margin of 0.5% to 1%. Hospitals are not making the kind of money you think they are. There are some who are. There are some who are doing very well, but the overwhelming majority are not. And now you have a better idea of why they're not. And how come your costs go up? Why does insurance go up? Insurance isn't going up because the hospital, is jacking you up. It's some of these other things that hospitals have to buy. And they have to take care of people. So there you go. That's what this video is about today. Like I said, if you have any questions or comments, let me know below. Y'all take care and have a great day.